Welcome to This Explainer. Today, we're going to unpack a genuinely fascinating and honestly highly unusual public health investigation that was recently detailed by the World Health Organization. We're looking at a rare virus outbreak, but here's the catch. It didn't happen in some remote rural village. It happened aboard a luxury cruise ship, the MV Hondius. It's an incredible story of medical detective work, rapid international response, and the completely unexpected ways our interconnected world can suddenly bring us face to face with ancient pathogens.
Right, so let's dive straight into this epidemiological puzzle. The absolute core question investigators were facing was this. How does a virus that is typically found out in rural fields and forests suddenly show up on the pristine decks of the MV Hondius? You see, hantaviruses are normally associated with sweeping out old, dusty barns or doing agricultural work. They are definitely not associated with luxury transatlantic cruises. So to really understand this, we need to look closely at the numbers and the timeline.
And the stakes of this mystery? Well, they became immediately clear to global health authorities. Out of 11 reported cases connected to the ship, 3 passengers tragically died. That results in a highly alarming 27% case fatality ratio. And for this specific strain of the virus, the mortality rate can actually sometimes reach as high as 40 to 50%, particularly for older individuals with existing health conditions. This was a severe, high-stakes situation, especially considering the passenger demographic had an average age of 65. Let's map out the timeline of this unfolding mystery. Tracking the ship's journey across the Atlantic, passengers started disembarking as early as April 24th in St. Helena. Then the ship moved to Cabo Verde by May 6th and finally arrived in Tenerife, Spain on May 10th. It was this wide geographical spread that triggered the WHO's international health regulations channels, because it required immediate, massive global contact tracing across all these different international ports.
Okay, to understand exactly what the WHO investigators were up against aboard the ship, we first need to define the illness itself. Hantavirus pulmonary syndrome, or HPS, is a severe zoonotic respiratory disease. Usually you get it from inhaling aerosolized particles from infected rodent urine, feces, or saliva. And it is a stealthy virus. The incubation period can be anywhere from 1 to 6 weeks. It starts off looking just like the flu or a stomach bug, fever, chills, nausea, before suddenly and rapidly progressing to severe respiratory distress and a massive drop in blood pressure.
And to give you an idea of just how rare this syndrome is, in all of 2025, across the entire region of the Americas, there were only 229 total cases of HPS reported. That is for a whole hemisphere over an entire year. So having a cluster of 11 cases suddenly pop up together on a single ship off the coast of Africa and Europe, that's an incredibly rare statistical anomaly.
But here is the massive plot twist in our medical mystery. Almost all hantaviruses around the world are strictly rodent to human. They just don't spread between people. But laboratory testing confirmed that the passengers on the MV Hondius were infected with the Andes virus. This specific strain, which is endemic to parts of South America, like Argentina and Chile, is the rare, virtually sole exception in the entire hantavirus family. It is actually capable of human-to-human transmission.
This realization was the absolute core of the WHO's findings. It was this unique biological anomaly, the Andes virus, that allowed the pathogen to spread from passenger to passenger. Without this specific strain's unique ability to jump between humans, this entire outbreak would likely have started and ended with just one single passenger.
So how did it actually happen? The working hypothesis from the WHO reveals a fascinating sequence of events. Step 1. Patient 0 likely contracted the virus during a land excursion in South America, possibly during an ecotourism activity like bird watching, where they unknowingly encountered infected rodent habitats. Step 2. They boarded the enclosed cruise ship. And Step 3. The close living quarters, shared indoor spaces, and prolonged interpersonal interactions on the ship created the perfect, albeit incredibly rare, environment for that human-to-human transmission to occur.
And what follows brilliantly illustrates the sheer level of detective work involved here. The WHO and their partner laboratories conducted genomic sequencing on the virus samples from the passengers. What they found was that the viruses were virtually identical, with no more than one single nucleotide polymorphism, or SNP, difference between them. In the world of genetics, this strongly indicates that the entire outbreak arose from one single, original spillover event from a rodent to a human, rather than multiple passengers getting infected separately on land. Which brings us to part 1. The international response, containing the outbreak. Once they realized what they were dealing with, the WHO, alongside national authorities, executed a massive logistical operation. They coordinated highly complex medical evacuations in the Canary Islands. And because of that incredibly long incubation period of up to 6 weeks we talked about earlier, authorities had to implement strict 42-day active monitoring and quarantines for high-risk contacts. They also had to meticulously track down passengers who had already flown home on commercial flights, and they deployed experts from the ECDC and WHO directly to the ship. To show you the true gravity of the situation, it was so significant that it prompted the WHO Director General himself, Dr. Tedros Adhanom Ghebreyesus, to travel to Tenerife on May 9th. He personally went to the Canary Islands to coordinate operations with Spanish national authorities, meeting directly with ministers and the Prime Minister to ensure the containment strategy was absolutely flawless. Now, the logistical execution to clear the ship was intense. Passengers couldn't just hop on a regular commercial plane to get home. Repatriation required specialized, non-commercial flights. Meanwhile, a dedicated Dutch medical team, including doctors and a nurse, actually boarded the vessel. Their job was to isolate and monitor the remaining 25 crew members as the MV Hondias sailed all the way back to the Netherlands, effectively turning the ship into a floating, quarantined observation ward.
On the clinical side of things, the response is incredibly challenging. There is no specific antiviral treatment or vaccine for the Andes virus. Because of this, the clinical response has to rely heavily on strict infection control, including airborne precautions during specific medical procedures and isolating patients in single, well-ventilated rooms. The absolute key to survival here is early, rapid transfer to an intensive care unit for life-saving respiratory support and careful fluid administration.
Moving on to Part 2, the verdict. Assessing the real risk.
The WHO's official assessment clearly divides the danger, and this is probably the most important takeaway for us today. While the enclosed environment of the ship presented a moderate risk due to those close living quarters and prolonged exposure, the threat to the general global population is distinctly low. The virus simply does not spread easily enough in normal, everyday environments to cause a global pandemic. In a highly reassuring statement, the WHO emphasizes, quote, "For the general public, the overall probability of infection remains low. Basically, standard tourism activities carry little to no risk of exposure to infected rodents. So you definitely don't need to cancel your travel plans over this. This was an extraordinarily specific chain of events." Because the virus requires prolonged, close contact to actually spread, and authorities have actively isolated infectious cases under a strict 42-day monitoring program, the chain of transmission has been effectively broken. Consequently, the WHO does not recommend any general travel or trade restrictions whatsoever. But while the WHO successfully contained this extraordinary Andes hantavirus cluster, it leaves us with a profound, lingering question. As our modern, interconnected world seamlessly bridges the gap between ancient forest-dwelling ecosystems and enclosed, climate-controlled luxury spaces, how do we prepare for the next microscopic stowaway? It is a stark reminder that as we explore the furthest reaches of the globe, our public health surveillance must travel right alongside us. Thank you for joining me for this explainer, and remember to keep asking the right questions.